Hi, everyone. Welcome to our Advantage Academy webinar series. I'm excited to have everyone here today. We are going to be learning all about sleep and how important it is to your health. That's me on the left, Tanya Sunderman. I'm the sales manager for the PHP Medicare. And Dr. Mamedov is on the right, and he is going to be our expert today talking about sleep. As always, if you have questions, you can put them in the chat. So any questions that you have about sleep in general, those types of things you can put in the chat. We will try to get to a Q&A at the end. We try to keep it right around an hour. We don't want to keep you too much longer than that. But if we have time, we'll get to those questions. If you have specific questions about a claim that you've had, maybe you went and got a sleep study and you weren't sure how it was paid for, and you have a specific question that's personal to you, those need to be directed to customer service. Our customer service number is on each side. There's also a customer service email address that you can email them directly as well. The agenda that we're going to cover today, we're going to talk about I got to move my screen here, the importance of sleep, quantity and quality, sleep disorders, and healthy sleep habits is what we're going to be talking about. And with that, I'm going to go ahead and turn it over to Dr. Mamedov. Thank you.
Hi, good morning, everyone. Thank you for the opportunity to talk to you. My name is Oktai Mamedov. I'm medical director of Comprehensive Sleep Center located in East Lansing and in Livonia of Michigan. I'm board certified in internal medicine and also in fellowship trained in sleep medicine. So I'm board certified in both internal medicine and sleep medicine, but I do only 100% sleep medicine in my office. Today I'm going to talk to you about sleep and some importance of the sleep and some sleep disorders and important things about our health, how sleep is affecting that. So why sleep is important? So important. Sleep is very integral and essential part of our life. Unfortunately, in the past, we didn't pay much of the attention, like a couple of decades ago, 20, 30 years ago. It wasn't so important because we were paying attention only for the daytime symptoms, everything that's happening only during the day, but not at night. We found that most of the issues with our health also could be part of the sleep, during the sleep. We spend 1/3 of our life in sleep, and that's why it's very important. And poor sleep can cause severe health consequences. Why is that? Because why we need to sleep, for example. First of all, during the sleep we get our memories are consolidated. Basically, during the sleep, especially in the REM sleep, our memory, whatever we learn during the day, it gets consolidated, which is necessary for our learning. Then it also helps us to ability to concentrate and pay attention. That's how we retain all that we learn during the day. During the sleep, there is a recovery processes going. So all our muscles or our body, all our organs get recovered. Aches and pains have a chance to heal. During the sleep, our metabolism is changing and it's regulated differently than during the night. So that's why it's very important, and it can affect our blood pressure, it can affect our sugar, insulin release, thyroid function, you name it, everything related to our health. And overall, getting better sleep, of course, it's better mental and physical health. So we can deal with day-to-day activities better. I want to bring it to your attention that most common sleep disorder in the United States, it's sleep deprivation. It means that we're not getting enough sleep or we don't get good quality of sleep. And it results in an average around $150 billion lost productivity per year. Next. So as I mentioned, how sleep is important on our health. Next. As I mentioned before, again, body and brain repair, increased resilience to the stress and injury, pain reduction. I want to talk about the pain. Why is pain so important, for example, for sleep? If we get good night consolidated sleep without any disruptions, our pain thresholds, it gets higher. So if the same pain, for example, for a person who's sleep deprived, it's going to be much worse versus the person getting the good night's sleep. Our mood regulation, our sleep mood, very well regulated by sleep. You all know that if we get good night's sleep, we feel better during the day. We have a better motivation. We have better mood. We're enthusiastic. We're energetic during the day as well. Of course, it's also affect our anxiety as well. Mental problems, depression, anxiety, all mental problems go together hand to hand with sleep and quality of sleep. Of course, as I mentioned, it's affecting our memory, learning, and immune competence. So a few words about the immunity. During the sleep, our immune system gets also recovering, and there is certain markers in our body that help us to fight infections and viruses. So certain markers that get recover and released during the night as well. So that's why having a good night consolidated sleep throughout the night is very important. Next. Yeah. So as you see, Dr. James O'Brien, like we mentioned that, said that sleep is not a luxury. It's a necessary for optimal functioning. Sometimes we take it as a granted, and we get busy in our life. We have lots of obligations to do, lots of duties, and the most commonly what we cut, it's usually sleep. But we have to keep in mind that our body, no matter what you do, need enough time to get rest. As I mentioned, we need the sleep for our body to relieve stress, grow, and balance our bodily chemicals. Next. So our brain needs a sleep in order to process the information that was absorbed. I mentioned that the importance of the REM sleep, and there's a lots of sleep disorders can disrupt our REM sleep during the night. And cause disruptions or in REM sleep, which can in effect affect our memory and learning process. Next. When I talk about the sleep and approach any patient or anyone with the sleep issues, I approach from the 4 points. Usually in main 3 ones, I approach from the sleep quantity, sleep quality, and sleep timing. So I'm going to explain that each one in separately. Basically, sleep quantity, how much sleep we get. So next, so National Sleep Foundation recommends, in average, for the most people get the 7-8 hours of sleep. Lately, it's 8 hours and more. I don't like the word of normal, because there is a could be normal variant of the short sleepers and could be normal variant of the long sleepers. What it means that some people require less than 6 hours sleep and they function absolutely fine based on the six or less amount of hours of sleep. And there is a people cannot function if they don't get 10 hours of sleep. So in average, most commonly people require 7 to 8 hours, and National Sleep Foundation recommend to get the 8 hours of sleep. So that's the most important part of the sleep quantitation. So, and when we say about the quantity, the 7-8 hours, it should be consolidated, non-disruptive, 7 to 8 hours sleep per night. As I mentioned before, the most common sleep disorder in our country is insufficient sleep, which is sleep deprivation. We don't get enough sleep, and as a consequence, there is lots of disorders. Actually, it can cause sleep deprivation by itself without any other sleep disorders, can cause problems with high blood pressure, mood changes, depression, anxiety, you name it, and increased stress. And of course, it can affect our immune system as well. Certain, again, biological markers are decreased during the sleep deprivation that can cause problems with the fighting infection during the day. Next. So, for example, there is this research done, on based on how much sleep we get and how much is equivalent on functioning of the people. For example, if it's too little, it could be to less than 6 hours of sleep could be equivalent to some 0.5 blood alcohol level. It's somewhere around 1 to 2 bottles of the beer. Less than 10 hours, it decrements can be seen in performance, and the cognitive function decreases that can cause also problems with the speed and accuracy, increase chances of motor vehicle accidents, and processing information. Next. Sleep, as I mentioned, sleep deprivation can cause also problems with the metabolic function. The important thing that during the sleep, we have some hormones that relieve during the night. One of them is called leptin, and another one is ghrelin. They both control appetite and fullness. For example, at night, ghrelin, which is a hormone, controls our hunger. It's supposed to be decreased, but if we don't get enough sleep or we have a disrupted sleep, due to sleep disorders, it could be dysregulated and ghrelin increased, which can cause problems with appetite, and people eat more. And as a result, if they eat more, they gain more weight, and then metabolic syndrome, and then there's diabetes, then increased high blood pressure. All these consequences can happen based on just disrupted sleep. And leptin is a hormone of the fullness. Basically, at night, our leptin is supposed to be high, and again, if it's disrupted, it goes low, and we don't feel full. So it's also increased our appetite. As a result, again, it gets higher rates of diabetes and obesity. I want to talk to you about also this, how sleep deprivation, for example, can cause problems with motor vehicle accidents. One of the very common samples I usually provide is a daylight savings time. For example, in spring, we get 1 hour less, and in fall, we get 1 hour more sleep. It's only based on one night of the sleep deprivation and 1 more hour sleep in fall. So if you look at the graphic, actually the day before and after the change in daylight savings, motor vehicle accident, for example, in spring doubled just in one day of 1 hour decrease in sleep. But in fall, when we get extra 1 hour sleep, motor vehicle accident next day after daylight saving changes is decreased by half. So that will show how important sleep deprivation and how important to get enough sleep during the night. Next topic, it's about sleep quality. So when we talk about the sleep quality, it's not about just how long we sleep. Now we're going to talk about the quality of sleep, meaning that how good we sleep, how disrupted our sleep. For example, fragmented sleep causes the similar consequences like sleep deprivation. It decreases our concentration, our attention goes down, our reaction time goes down, mood, we become irritable. It also change the same pattern, memory impairments. Some of the causes of fragmented sleep, it could be temperature, light, noise, pain. We all suffer from some pain throughout our life. Anxiety, stress, we can't go away with the stress. It's always going to be there. And of course, some sleep disorders, like snoring, like sleep apnea, periodic limb movement disorder, or restless leg syndrome. I'm going to talk about the periodic limb movements and restless legs later on, so I will tell you the difference between the two of them. Next. So sleep timing, when I approach a patient about the sleep timing, it's very important when we sleep, because we can sleep, for example, shift workers, they can sleep at the during the day, they can get their own, 7-8 hours consolidated night, good quality sleep during the day, but it's not going to be equal when we sleep during the night. So we human being, we designed, we're diurnal, meaning that we function during the day and we sleep at night. And our circadian rhythm is designed in a way that we're supposed to sleep between 12, 10 p.m. to 12 a.m., usually, like 10, 11 p.m. until morning, by getting 8 hours in bed. So if in any case, for example, in shift workers or in any people that have circadian problems, that they sleep earlier than that time or they sleep later than that time, it can cause some asynchrony in the body. So the internal clock doesn't synchronize with the outside clock, and that can cause some symptoms. We all travel, and for example, when we travel from east to west or from the west to east, it's usually more pronounced when we move from east to west. We get jet lag. So it's a similar symptoms than when we have we're not sleeping on the right time of the day or night. We get this jet lag symptoms, which it could be poor concentration, nausea, feeling tired, not feeling himself, like kind of flu-like symptoms. So timing is also important. It's very important for people with a shift work disorder and for people that have circadian disorder. And when I talk usually for with the people that, for example, when they go to most of my patients that they get on they get retired and they think that that's they have a freedom to do everything, that can change dramatically the circadian rhythm. So they think that now I'm not on schedule, I don't have to wake up early, so I can do whatever I want. And unfortunately that can throw them off from their schedule circadian rhythm. They stay late and then they're sleeping in the morning. So that can change the circadian rhythm and can cause those problems and symptoms. The problem with that more we delay our bedtime, it's easy for us to delay more versus going to bed earlier. That's how we designed our circadian rhythm, usually more than 24 hours, at 24 hours, somewhere 15 minutes. And that 15 minutes can add up every day to move your bedtime to late, early morning, and sleeping in early, later in the morning as well. So we have to be very careful, changing the schedule, keeping the good sleep hygiene, having the regular bedtime and wake up time same. Either we're working or we're retired or we have nothing else to do. Next. So as I mentioned, that the consequences of asynchronous sleep, when we don't sleep on the right time, it can cause problems with alertness, cognitive errors. We don't feel as good. As I mentioned, that we can have some jet lag symptoms. Shift work is the same symptoms that during these conditions. Next. Okay, now we get to the point that we're talking about other issues that can affect sleep quality, and it could be many other reasons, other sleep disorders. The most common one is snoring. Snoring, I want to tell you that I want to say that snoring is just a sign of obstruction. So snoring is a vibration of our uvula and soft palate. Usually it's a soft palate, like it located at the back of our throat. That usually happens when we have some obstruction. Not everyone who snores have sleep apnea. Sleep apnea is a sleep disorder, sleep breathing disorder, that when we stop breathing or we have shallow breathing during the night without even realizing that. Next. So what happens, as you see on this picture, on the left side, our airways are pretty patent, and we can get the air On non-obstructive airway, we can get the air through nose and the mouth, and we're passing the air to our lungs, where there goes gas exchange with oxygen and CO2, and we're breathing fine. But when we have sleep apnea, for example, we get obstructed airways, the tongue and uvula, soft palate, all the structures at the back of our throat. On the picture on the right side, you can see like it blocks, obstructs our airways, and it can cause problems getting air in, like oxygen. With air, we get the oxygen, and getting out the CO2, which is carbon dioxide, that can also get accumulated in our blood and can cause tiredness and sleepiness and other metabolic problems. So what happens when we're sleeping in your brain, your brain can notice that when we stop breathing, and it's wakes up briefly, reopen the airways. Those awakenings are very brief, very short, and that's why most of the time people are not aware of them. Sometimes, like most of the time when I see patients and they say that, like, I see you just because my wife or my bed partner tells me that, like, I'm snoring, I'm choking, gasping, but I don't have any problems with my sleep. I'm sleeping fine. I go to sleep, I don't wake up, and I sleep like a rock. That's the problem with sleep apnea, that most of the issues with the sleep apnea with asymptomatic, meaning that people don't have the symptoms. They just based on some observation from their bed partner, that they can come and seek the help from the sleep doctor or the primary care provider. And it can happen, as you see, it can happen many times during the night, that people wake up multiple times without even realizing. So what happens when our airways get collapsed, when we wake up multiple times during the night, our sleep is get disrupted. And as I mentioned before, more disrupted sleep, so more problems with the focus and concentration, mood, pain issues, and immune system. And the most important thing, that when we don't get air, we don't get oxygen. And we need oxygen for whole our body to function, especially very important for our brain and our heart. So there is two types of sleep apnea that exist. There is obstructive sleep apnea, which can caused by just obstruction, as I mentioned before, in upper airways. And there is a central sleep apnea, when the brain fails to signal the muscle to breathe. It's very uncommon, and happens only on 10% of patients. Usually central sleep apnea associated with heart disease, congestive heart failure, problems with the lungs or brain also. Next. So some numbers, some amazing facts and figures about sleep apnea. So when we don't get enough, as I mentioned, oxygen, it's going to affect our heart and whole body. And almost 26% of adults in the United States are suffering from it and remain undiagnosed and untreated. And over 50% of all these apnea cases are diagnosed in people aged 40 and over. I want to tell you that sleep apnea happens in all population. Doesn't matter young, old, or middle age. Doesn't matter. I see patients 2 and above. So I have a lot of patients with children that may have sleep apnea, especially with a rate of obesity going up in our country. So it's a disorder of all ages. It doesn't have to be a certain age. And for example, sleep apnea associated with many disorders like high blood pressure. 30 to 83% of patients with high blood pressure, they have sleep apnea. Actually, sleep apnea increases the chance of heart problems, high blood pressure, heart attack, and stroke 6 times. 6 times people with sleep apnea, 6 times more at risk of having those complications versus people that don't have sleep apnea. So what's a risk factor to have sleep apnea? So there is a couple of risk factors. Basically, it's a larger neck, 17 inches or greater for men and 16 inches greater for women. I have a lot of patients that they athletes, They come and they in good health, the athletes, they do the football, they do the wrestling, for example. They think that they can be very healthy because they're active, right? But there is a risk factor that, for example, being a big athlete, having big neck can cause sleep apnea. And most unfortunately, most of the patients in this category of athletes, they have sleep apnea because bigger the neck, there is a more chances of that airways will be collapsed easily than people without, with not increased neck size. Large tonsils, large tongue, and deviated nasal septum. This is all risk factors. So as you know, as I mentioned, that sleep apnea, obstructive sleep apnea happens at the back of the throat in upper airways. So if you have large tonsils or large tongue, there's not much space when we're sleeping at night. And what it does, it just goes to the back and collapsing and obstructing our airways. It's very common that patients with a sleep apnea have some family members, because it may not be just, for example, obesity or large neck. It could be also the genetic predisposition due to the anatomy of airways, the way that we design, like how our airways curved, for example, or how floppy our airways. That plays also a huge role as a risk factor for sleep apnea. Many patients with sleep apnea also have gastrointestinal reflux, which is GERD. We call it GERD. Basically, it's a disorder of acid coming to the to the upper esophagus and causing some issues with a pain and also discomfort. Of course, any allergies, nasal obstruction, deviated septum, all this causing inflammation, which in turn causing the swellingness of our airways and causing this narrowing airways, that would put at risk of having sleep apnea. Next. So as I mentioned, what can sleep apnea lead to? So if it's not controlled, if it's not treated, it can cause a lots of disorders and the consequences like high blood pressure, heart failure, irregular heartbeats, and heart attacks. I want to tell you that, for example, in terms of heart attack and stroke, it's been shown in the research that most of the heart attack and stroke happens in the morning, and it's usually between 12 and 6 o'clock. So that's why we used to pay attention only for the daytime symptoms, but most of them can be originated at nighttime. So what happens when oxygen drops at night, when we have sleep apnea, it can trigger irregular heartbeats. When it's irregular heartbeats can cause formation of the blood clot in our body, in our vessels, and the clot goes to brain. It can cause the stroke. If the clot goes to, for example, heart arteries, it can cause heart attack. All this takes a couple of hours, and it happens during the day, and we don't really get relay that to the nighttime symptoms. So that's why now the sleep medicine is very important and become very popular, especially for treatment of the high blood pressure, heart problems, diabetes. Again, it can cause also diabetes, because what happens when we stress our body at night, when we don't get enough oxygen, our body is stressed out. When it stresses out, it releases cortisol. It's a stress hormone that puts us at the fight or flight situation condition. And what our body does, it actually holds to the sugar. That's why it can cause diabetes. And it also holds to the fat tissue, so we get more obese. So multiple stress, consistent, continuous stress during the night can cause diabetes and obesity as well. Of course, if we don't get good night's sleep, frequent accidents while driving, it also can cause a negative impact on pregnancy due to hypertension. Again, multiple awakenings can cause increased high blood pressure. And it also affects our work, cognitive function, our memory, thinking, and reasoning. It's a big deal. In schools, in children, for example, in children, sleep apnea and disrupted sleep, insufficient sleep, poor quality of sleep can cause problems opposite than tiredness and sleepiness and like in adults. It's causing problems with the focus and concentration, so-called ADD, ADHD symptoms. And there is a huge overlap between symptoms of ADHD and the sleep apnea. That's why I have a lots of patients that I check before they put them on medication for the problems with the sleep, just to make sure that their sleep is not affected, their performance. Well, there is a lots of questionnaires that designed to see if the patient is at the risk of having sleep apnea. One of those, for example, that you have now on your screen. If you've been told that you snore, most of the patients, they say that, like, I don't snore, because they're not really aware that they do. It's usually bed partner or somebody during the travel, the family member can mention that, or friends when they go to travel or cabin up north or anywhere during traveling, they can notice that, like you snore, or you gasping, or you choking during the night, or you stopping breathing at night. In a moderate to severe cases, patients themselves also can, experience that symptoms when they wake up. They sometimes feel like, oh, they woke up for no apparent reason. They feeling like they heart racing, they short of breath, or they woke up for no apparent reason. It could be sign of sleep apnea. So if you, for example, ask yes to answer yes to any of the two questions above, you can be at risk of having sleep apnea, more than 70% the chance. Next. As I mentioned, that it can cause sleep apnea, can increase chance of motor vehicle accident because of our decreased focus and concentration, up to 15 times, motor vehicle accident 15 times. And the studies show that when we treat those patients, it reduces risk to the regular normal rate. Next. So how do we know that we have sleep apnea? Basically, the only gold standard way to find out that it's to do the sleep study. It's called sleep apnea test, and usually it can be done. It can be done in the lab when the patient comes to the lab in evening time, the habitual bedtime. We put a lots of wires, sensors, 24 wires. Nothing is invasive. Everything on top of the skin, and we just monitor them until morning. We monitor the heart. We monitor the movements, brain waves, oxygen level, their breathing. That's the gold standard. But there is also the home sleep study, which is more convenient for patient that doesn't want to go to the clinic and spend the night over there. They can get the kit from clinic. We can show how to use it. They take it. Of course, it's much less sensors. It's 3 sensors, but it's enough to see if the patient has sleep apnea or no. And as I mentioned, if we treat the sleep apnea, it reduces the risk of heart attack, stroke, accidents, and any surgical complications. And most patients experience the best result with the CPAP. And I want to talk about the treatment. CPAP is a continuous positive air pressure. It's a treatment for sleep apnea. Next. So basically, that was this is the not the real nowadays presentation of the sleep study. That's what we had in the past. Nowadays, it's more, of course, evolved. We have sensors that attach straight to the head and just on the skin. It's a non-invasive. Patients spend the night. They have all private room. They can go to bathroom, and many times they want during the night. Our technicians will, accommodate for that, and they usually get monitored from around 9 p.m. till 6 in the morning. Next. So where should you have your sleep study? You should have sleep study done at the place where it's directed by physicians, where the doctor can follow up with you for the results, where the doctor is board certified in sleep medicine, because there's lots of doctors that do that on like a side business. But if it's a board certified, fellowship trained, they just do that. it's a better outcome. And they have also CPAP compliance program. What's a CPAP compliance? I'm going to talk about the CPAP treatment, which is a continuous positive air pressure device. And when we follow up with the patient and address any issues with the compliance, so to make patient more comfortable to use the device in the future. It's a big change in the patient's life when they get treatment with a CPAP or any other treatment. There is a new treatment ways of available, like oral appliance or even the surgery. So, but the CPAP stays until till now. It's a gold standard treatment for sleep apnea. Next. So again, few pictures how it looks in reality now. This is how the wired applied, sensors applied to the patient and the kids. They spend the night in the sleep clinic. Our sleep clinic, it's looks like a hotel kind of settings. We try to make it as much as possible, like in a home situation, not like hospital with beeping equipment or anything like that. So they feel more comfortable to have a study done. Next. So here's again, I just want to reiterate how the sleep apnea can cause problems, the consequences and the complications, how it can cause the problems with diabetes, motor vehicle accident, obesity, high blood pressure, increased chances of having heart attack, stroke, memory problems, mood changes, and one of them is grinding the teeth, bruxism. Bruxism is teeth grinding while you're sleeping, which could be sign of sleep apnea as well. Next. So I want to give you some numbers about the untreated sleep apnea cost. It's around 3.5 billion a year for the sleep for people that untreated for sleep apnea, and it's around 1,336 per patient. That's the annual medical savings of diagnosed patient compared not to diagnosed patient with OSA. And it takes up to 2 years. That's the amount of time it takes to see hospitalization decrease after a patient receives a diagnosis and treatment of sleep apnea. It's very common that patients, for example, going for the surgery, before surgery, they need to be checked for sleep apnea, because when we during the surgery, we put them on some medication that can affect their breathing. Taking them off from the medication and from medication and the recovery, their breathing can be affected if they have underlying sleep disorder like sleep apnea. So it's very important to treat that ahead of time so the patient doesn't get any post-surgery complications and problems with the breathing and oxygen level. Next. Some numbers about how prevalent is sleep apnea. For example, 30% of obese people have sleep apnea. 90% severely obese have sleep apnea, and it puts like twice to the risk of having sleep apnea versus your normal weight adults. Next. Another numbers, diabetes, 75% of adults with type 2 diabetes have sleep apnea, and 86% of obese adults with type 2 diabetes have sleep apnea. And it's OSA, obstructive sleep apnea, is independently associated with a glucose intolerance and insulin resistance, which can cause diabetes. Next. High blood pressure, as I mentioned before, 30 to 40% people with high blood pressure have sleep apnea. 80, we have a lot of patients that on couple of at least 2-3 medications for blood pressure. We usually don't know the reason for the patient having high blood pressure issues. That's why we call it essential hypertension. But sleep apnea can be underlying disorder. So most of the times when primary care doctor or cardiologist put patients on the multiple medication and the blood pressure is not under control, they consider then the sleep apnea test to make sure that there is no other sleep disorder causing increase in blood pressure. Next. As I mentioned again, OSA increased risk of ischemic stroke by 3 times, and overall of mortality from the heart problems by 5 times. And of course, OSA is a predictor of sudden cardiac death in many patients. When we treat patients with the sleep apnea, it reduces heart attacks by 50%, almost 50%, 49. Reduces the stroke by 31%. It's a relief sleep apnea symptoms, and as also improves the daytime sleepiness and other complications, mood changes, memory issues. Lately there is a lots of studies showing a huge link between sleep apnea and insufficient sleep with dementia and problems with memory, and focusing, concentration, processing information. Um, Treatments of sleep apnea doesn't cure them from dementia, but it stops the progressing the disease, because intermittent drop in oxygen level can affect our brain, and it can affect our memory and memory consolidation. Next. Of course, the treatment of sleep apnea, if we overweight, decreasing the BMI, our weight loss is number one. But sometimes it's very difficult to achieve if we don't have a good night sleep. We don't get enough, energy during the day. And everyone says that you have to work on your weight, but when you don't have energy to do something, then it becomes like vicious circle. And we need to break that circle. We need to really address to your sleep issues. If you have that, you may not even know that you do have that unless you've done some research, or you've done some studies showing that you may be at risk of having sleep issues. Avoid alcohol consumption, sedative medications. We usually like when we have some problems with the sleep, and most of people have lots of issues with the sleep. We jump for the magic pill. We're trying to get easy fix. We're jumping for over-the-counter stuff like melatonin or Benadryl, diphenhydramine. I want to tell you that most common drugs, over-the-counter drugs used is antihistamines, and they're not good for our body unless you have any comorbid allergies, for example, nasal congestion. I wouldn't recommend anyone to take over-the-counter antihistamines. It's very bad for our health in terms of bones, in terms of urinary issues, in terms of constipation and other functions. Antihistamines been linked to many issues with the memory, and focusing, and processing the information during the day as well. It gives some kind of like a hangover effect during the day. So I would recommend to stay away from those kind of easy fixes from insomnia. In the past, for example, we used also snore ball technique. We used to have tennis balls sewed to our pajama or the t-shirt to keep us away from our back, because snoring and sleep apnea most common usually on your back and in REM sleep. We don't do that anymore because there is a better ways of treating the positional sleep apnea. There is a certain belts that can be recommended by your sleep specialist. There's lots of studies been done on different type of surgeries. In the past, it used to be like first-line treatment. Not anymore. For example, in children, it's a first-line treatment. For adults, it's not recommended to have a surgery because it has a very low success rate, like less than 25%. There is a different advertised way of treating snoring, like Provent. By the way, this business went out of business. Now they're not selling those stuff that helps with the snoring. One of the alternative to CPAP, for example, it could be oral appliances, oral devices for sleep apnea. It's not the same device like for the grinding the teeth, similar, but it's made in a way that it protrudes the lower jaw forward. usually in mild to moderate cases, it could be a good alternative for CPAP if someone doesn't want to wear CPAP mask or use CPAP, continuous positive air pressure device. And talking about the CPAP, next, please.
Doctor, I just wanted to give you we have 15 minutes left.
Okay. So even treating the sleep apnea, it also improves our attractiveness. It can cause improved, mood. It cause a lot of, it's cause us being more alert, more youthful, less forehead creases. So there's another reason to be treated if you think that you may have this issue. Next. Most of the people, patients, when they talk about CPAP, they get kind of reluctant about the CPAP. They always imagine that CPAP, it's a big bulky mask that you have to wear like a pilot. Nowadays there's a lots of new evolved way of treating sleep apnea with a different type of interface. It could be as small as this, for example, masks that you see. It's called nasal pillows. It's less intrusive. It's very comfortable to use. The hose, if you see that hose is movable, and it gives you more freedom to move while you're sleeping. Turn to the side and change position. The mask could be over the nose, under the nose, could be over. Basically, the type of the mask that you choose, it's based on your comfort level, not our decision, not the sleep technician decision or doctor decision. It's your choice. That's why when we do the study in the lab, we can try that. So it may not be as intrusive as you'd imagine. It cannot be as bad as you think. Actually, most of the patients, when they, in the beginning, when they see me, they very adamant or reluctant, kind of, how I'm going to tolerate that. But a couple nights, couple of weeks, you get used to it, and then they feel the benefit, and they can't really sleep without it. So keep in mind that it doesn't have to be bulky, big masks. Next. Like this one as well, similar, just under the nose. Next. Or over the nose, it's just a over the nose nasal mask. Next. And that's the full face mask. We usually use full face mask in like a last choice, because if the patient, for example, have issues with mouth breathing and they venting through mouth, ear, they need to use the full face. They can use the full face mask. If they have a nasal obstruction, for example, they can breathe through their nose. Although most of patients that I use nasal mask opened up the sinuses, and they breathe easier with a nasal mask as well. Next. This is how the oral devices, oral appliances made and designed. If you look, so the lower side of the appliance, it's moved forward, which makes our lower side of mandible, chin moved forward, and by moving the forward, it opens our airways. So that's alternative treatment for sleep apnea as well. I want you to consider that. Keep in mind that it's also available. Next. There's a different designs of it, different manufacturers, different labs that do, but the idea is the same, just to move the jaw, lower jaw forward, protrude that forward. Next. Okay, so some at the end, due to time limitation, I'm just going to give you some advices about your regular routine. Having good night's sleep. It's very important to have a good sleep hygiene, regular bedtime, wake up time. That will help us to have very good consolidated sleep during the night. It doesn't throw off our circadian rhythm. So having the good schedule, it's very important. Next. Having some ritual, bedtime ritual is very important. Some people like to have some, wind down period before the sleep. Regarding the taking bath, I want to just mention that taking bath, it should be at least 1 hour before bedtime. most of people take a bath and go to bed, which I don't recommend, because we designed to way that we sleep better when our temperature goes down. On the lower temperature, we fall asleep easier. So that's why when we cool down after taking bath, it's easier to fall asleep 1 hour after that, or making your bedroom cool. That will help you also to fall asleep easier. Next. So having bedroom only for the sleep, that's very important, because some people unfortunately use it as an entertainment place when they're using their TV or they're using their computer, laptop, or any electronic devices. You have to put that on the side, because it can also affect your sleep by releasing the melatonin. The light from those devices can affect your brain, eyes, and decrease the melatonin, which is released during the night to help us to fall asleep. So less light, dim light at night, less light exposure in evening, but more light exposure in the morning will help us to stay more alert and keeps us on the right schedule. Next. Of course, cutting down the caffeine or alcohol, any stimulants, and of course, smoking. It will help us to fall asleep easier. I also strongly recommend people not to watch the clock. That can cause detrimental changes to our anxiety and problems with the falling asleep. When we put our brain at track of controlling the time, and it's causing more anxiety, more problems falling asleep, please avoid to look at the clock. If you need to wake up, set the alarm, wake up on alarm, but don't look or watch alarm all night long. Next. Being, like our sleep is also depending what we do during the day. There is a clear correlation that more busy, more alert we're during the day, more sleepier we're at night. So being active, being exposed to light during the day, it's would be a good idea to keep us alert so we can develop better, sleep during the night. So as you know that like any other doctors, we recommend to be more active during the day, exposed to light. Next. As I mentioned before, get away from the screens. The blue light from the screens can cause problems with falling asleep and decrease the melatonin in our brain. Next. Sometimes I do, I do recommend for patients, if they have to be, for example, they're doing their homework or they have to do something, they can use even sunglasses to decrease the exposure to the light in the evening, or use the glasses with a blue light filter. But still, it's all the exposure to the light emitting devices should be 1 hour before bedtime, and keeping your bedroom cool will help you to fall asleep and get better Z's at night. Next. As I mentioned, like we're never going to be catch up on our work or responsibilities. So it always we try to catch up on our work. It's never going to be enough. So our body needs as much as sleep we need. So try not to stay up late to get your work done. Because you're going to pay the price next day. Next. As I mentioned, clock watching is very detrimental. So please don't watch the clock. Turn it around. Set the alarm if you have to wake up, but don't keep looking at the clock during the night. Next. So most of the people that when they can't sleep, they staying in sleep, in bed and trying to force them to fall asleep, or they go to use their phone or any electronic devices. More we stay in bed, more anxiety we get. So we usually say that when you get annoyed, please get out of the bed, do something boring. Don't expose yourself to bright light, no computers, nothing. Reading maybe with a dim light, something boring, or doing something boring will help you to get tired and go back to sleep only when you're tired. Next. Again, not enough sleep gets all these consequences that we discussed before. All these issues that you see, I don't want to repeat myself. So like heart problems, memory issues, you know, and problems with the immune system, fighting infection, all could be the consequences of not getting enough good night's sleep. Next. In closing, so I want to just say that, it's important to get good night's sleep, to feel rested and ready for the next day. So as I mentioned before, getting, at least 8 hours sleep would be a good idea. And getting, again, good quality of sleep is very important as well. If you have any concerns, any problems about your sleep, or everything is ruled out and you continue to feel tired and sleepy despite of all your labs are fine and all the workup you've done is fine, it may be a good idea to get the referral and see sleep specialists about that. I think we're done, right? There is some
Yeah, I
slides
think,
for your entertainment.
yeah, I'll let Lindsay flip through those. There's just a couple of questions here. Some of them you answered during the presentation, so I won't go back to those. But the first one I got is somebody said I'm sorry.
Yes, go ahead.
Okay, I just didn't know if you could hear me.
Yes, I did.
That they track their sleep with a smartwatch, and they typically get 6.5 hours of sleep, and of those, 1.5 are REM sleep. I'm 70 years old and a CPAP user. Is this normal?
Okay. Well, yeah, the wearable devices now is very popular. They're very helpful for us, for the sleep doctors and specialists to somehow to monitor the sleep, and it's very informative also for patients. But I want to tell you that those wearables are designed on different algorithms, not the same algorithm that we're using, not the same sensors that we're using in the lab. They're not really FDA approved for that. So they're using some algorithms that not real. Basically, usually the time of the sleep, not sleep, somehow correlates with the real numbers. But the stages of sleep, how deep you sleep, how much REM sleep you get is not really well correlated. Again, this algorithm based on actigraphy, that's a device that when we move or don't move, it take it as a sleep. And the certain parameters like heart rate or heart rate can be monitored, and based on that assumption they make a decision about the stages. So I would take that with a grain of salt, what it says about the stages. Don't pay too much attention to that. And most important, that how long you get sleep and how you feel during the day, what's your normal amount of the sleep. And if you see multiple, for example, arousals, usually it's a red lines on all these downloads that you can see on your wearables, that's then the red flag. But otherwise, I wouldn't be too focused on how much deep sleep you get and how much REM sleep you get, because it changes from day to day and is not as accurate as you think on these devices.
All right, thank you. I can attest to that because I wear a smartwatch, and
Yep.
I sometimes I'm like, I know I wasn't asleep at that time that it says I was sleeping. I just was not moving.
Exactly. So basically, some insomniacs, if you lay down there and don't move and you can't fall asleep, the device will take it as you're sleeping and you're not moving, so you're sleeping, which is wrong. It doesn't
Yeah.
really check your brain waves, or doesn't check any other parameters based on your heart rate and blood pressure variability. So the algorithm is different. It's a more serious devices that we use in the lab that we can rely on versus the variables that the device. But I mean, it's good for information, and sometimes there's concern. Yes, it's good to keep in mind, but is it definitive? No, I wouldn't rely on that too much.
Okay, thanks. It looks like the other question that we had was geared towards the smartwatches too, and you've answered that. And then I have one last question here that's more a personal question about a referral. Those can go to customer service. So I would contact customer service, which is on the back of your insurance card, and they can give you the answer to that by calling or emailing them. So I think we're right on time. That was great. I really appreciate Dr. Mamedov coming today and talking to us. This is super interesting to me. I know, I mean, I'm sure we all know personally how lack of sleep affects us and how important it is. But it's really eye-opening to see all of the health ramifications that can happen due to lack of sleep. It's so important for our overall health. So I really appreciate you addressing that with everyone. We will send out Dr. Mamedov's information at the Comprehensive Sleep Center if you're interested in contacting his office. We will include that in the follow-up email. We will include a link to the recording of today's session. It will also be posted on the member portal on our website. So if you don't have access to your member portal, you can call customer service and they can get you your log-on for that, because in addition to Advantage Academy information, there's information on how to use your plan and things like that. So Lindsay's putting up our last slide here with our customer service number, our email address. I have to look around here, I have another screen. So if you have any personal questions that you want to have addressed, you can contact them directly. So thanks again, everyone, for joining us today. Thank you, Doctor, for coming. Oh, and one last slide here. We're doing a little summer break over July and August and probably September. And then what we're going to do in October is what we call the ANOC review. That's the annual notice of change. So we're going to go through any changes to our Medicare Advantage plans in a webinar format, so before that annual enrollment period what our plans are going to look like for 2024. So that I think will be helpful, because if you've been on our plan for a while or another Medicare Advantage plan, you get a pretty lengthy document with a lot of words in it that explain the changes that isn't always 100% clear. So this is an opportunity to get that explained to you and to ask questions on that too. So we want to keep that simple for you. So, all right. Thanks everybody for coming. I hope you all have a wonderful day. And thank you, Doctor, for joining us today. We appreciate it.
Thank you very much for the opportunity. Yeah. And I would be happy to help anyone who, need a help. Thank you.
Wonderful. Thanks.
Bye.
Bye-bye.